everyone. Today I'm going to talk about a very important topic, wherein the people of the various group collaborate together for delivering the care for a mentally ill client. So you're going to learn about the multidisciplinary mental health team. So as the name says, multidisciplinary, multi meaning many, disciplinary is the various disciplines or the areas. So we have got people from many disciplines or from different fields who will be collaborating, coordinating together for delivering the services to the mentally ill client. So the teamwork is a very important and significant one in any setting. So we can say that holistic care can be given to the clients when we have got a team which is working together. So the milieu needed for the care of the patient depends upon the qualification, experience, and the skills of the members and the way they treat the client in the various situation with a similar approach. So very important that when you are going to give a care for a mentally ill client, so we should have the team who are well qualified in the particular field of the discipline, who are having the experience and the skills when you are going to deliver the care for the client. For the promotion of the therapeutic environment, members of the various disciplines are needed to coordinate together for the particular activity. So we have got very important, we can say, the core members of the mental health team. So very important four members, we can say, of the mental health team. We have got the psychiatrist, the psychiatric nurse, we have got the clinical psychologist and the social worker. So these are the four important members of the mental health team. So before going to actually the team members, let us learn about the meaning of teamwork. So very important to know what is teamwork. So it is the paramount for the success of any group. So in the psychiatric unit, so we have got a group who work together, and it's very important that the teamwork is done so that the delivery of the care is benefited to the client. So teamwork meaning, what is the meaning of teamwork? Teamwork means the combined, coordinated and dedicated effort of each and every member of the team towards the achievement of the vested interest, target or goal of a team as an entity. So it is the collaborated effort, we can say, or the combined coordinated effort of each and every member of the team, based on the goal. To reach a particular goal of interest, they have to coordinate, they have to combine, they have to collaborate together so that the goal or the target is met effectively. Teamwork becomes more significant in mental health setting where the contribution of all the members is extremely important and vital for the assessment, diagnosis, treatment, or inpatient rehabilitation as well as the community-based rehabilitation of the mentally ill patients. So this is about the team work. So moving on to the concept of the multidisciplinary team. What is the concept of the mental health team or the multidisciplinary team? So the multidisciplinary team can also function as interdisciplinary team in that the total care of the patient requires not only the total input of the each member of the team but also the interdisciplinary coordinated effort. So when we have a team, they are not only coordinating together but they are depending on each other. So that is why a mental health team is called also as a interdisciplinary team which depends on each other. A psychiatrist depends on a psychiatric nurse for the delivery of a care, or nurse depends on a psychiatrist, or we have social worker, we have got the psychologist. So all these members depend on each other. So we can say that interdisciplinary interdependent team who coordinate together for the delivery of the services. One can compare this concept to an orchestra led by the music director. So you know, an orchestra, when you take an orchestra, you've got various members of various musicians, right? You've got different members who are there who are playing their own specialized area of music, and you've got a music director who is going to lead the particular team. So similarly, when you take a mental health team, you've got various mental health professionals and paraprofessionals who will be led by the leader, who is the psychiatrist. So we can compare this to an orchestra where in the particular environment, or we can say the milieu for the delivery of the care, we have got the various members who are interdependent on each other, and it is led by a leader who is the psychiatrist. Each member of the orchestra has to give in his own input, and simultaneously there should be a coordination with each other. So we'll move on to the members of the team. So who are the members of the mental health team? So we have got, if you can see this picture, you have got a psychiatrist, nurse, clinical specialist, registered nurse in psychiatric nursing, clinical psychologist, psychiatric social worker, psychiatric paraprofessionals, occupational therapist, recreational therapist, diversional therapist, creative art therapist, and the clergyman. So these are the members of the mental health team. So you're going to learn about each and every member in detail, what should be their qualification, what should be their experience and skill for delivering the services. The first one is the main member of the mental health team, who is the psychiatrist. So the psychiatrist is a doctor with a post-graduation in the field of psychiatry with 2 to 3 years of residential training. So he is a doctor with an MBBS degree, and he should be specialized in the field of psychiatry, and he should have an experience in dealing with the mentally ill clients of at least 2 to 3 years. The psychiatrist is responsible for the diagnosis, treatment, and prevention of mental disorders. He will prescribe the medications and somatic therapy and function as the leader of the mental health team. So what is the responsibility of the psychiatrist? So he is the one who is going to do the assessment, will be doing the diagnosis of the condition, who will be prescribing the medications for the patient. Not only that, he'll also be an important member for the prevention of the mental disorders, and for also giving the somatic therapy. So in some conditions, we give the somatic therapy, which is the ECT. So psychiatrist is the one who will be also delivering the ECT services, and he is the main member. So he is called as the leader of the mental health. So the second member of the team is the psychiatric nurse clinical specialist. The psychiatric nurse clinical specialist should have a master's degree in the psychiatric nursing, and preferably she should have a post-graduation in the research work. So what are the responsibilities of a psychiatric nurse clinical specialist, right? She participates actively in the primary, secondary, and tertiary prevention of the mental disorders, and provides individual, group, and family psychotherapy in a hospital and the community setting. So she is the one who will actively participate in the prevention of mental disorders in the community. So it can be the primary, secondary, or the tertiary prevention for the individual, for the family, as well as the community as a whole. Right? She also takes up the responsibility of teaching, administration, and research, besides publishing her work in the mental health nursing. The role of a leader and can practice independently. So a psychiatric nurse clinical specialist can also practice independently. Right. So the next member of the team is a registered nurse in psychiatric unit. So who is a registered nurse in psychiatric unit? The registered nurse undergoes a general nursing and midwifery program, or a BSc program, undergraduate program, or a post-BSc nursing program with added qualifications such as diploma in the psychiatric nursing, diploma in the nursing administration. Right? She is the one, one who is a candidate who can become a registered nurse in a psychiatric unit. So she should have a basic diploma in the nursing, or she should have a undergraduation program in the field of nursing with a specialized training such as a diploma in the psychiatric nursing. All right, so we can call her as registered nurse who can work in a psychiatric unit. So the nurse, what is the responsibility of the registered nurse? Right. The nurse is skilled in caring the mentally ill and gives a holistic care by assessing the patient's mental, social, physical, psychological, and spiritual needs, making the nursing diagnosis, formulating and evaluating and rendering the appropriate nursing care. So she is the one who is actually working with the mentally ill client at the bedside. She is the one who is going to assess the condition of the patient, who is going to diagnose what is the problems of the patient. She will be one who will have an important role in the observation of the behavior of the client, and also she will deliver the appropriate nursing care. So we can say the holistic nursing care which can be delivered by a registered nurse who is working in a psychiatric unit. So she will coordinate with the clinical nurse specialist in the community health setting, and she updates the knowledge via the continuing nursing education, in-service education workshops and courses conducted by the Open University. So she will update as and when there is a change in the society. So she has to update her knowledge by attending various workshops, it can be, or it can be the educational programs, continuing the education programs, or various courses which are conducted by the Open University. So this is about the registered nurse in a psychiatric unit. So the next member is a clinical psychologist. So the clinical psychologist is the one who holds a degree in the clinical psychology and is registered with the Clinical Psychologist Association. So he should have a specialized degree in the field of clinical psychology, and also he should be registered with the Association of Psychology. Right? He or she conducts the psychological assessments or diagnostic tests, interprets the diagnostic test, the psychological test, and also evaluates the findings of these tests and implements a particular program for the modification of the behavior. So she is the one who is going to do the various psychological tests. So based on the condition of the patient, they are going to put in or diagnose the condition of the patient based on the psychological test. They will interpret, and also they are going to give the result, and which will help in the giving various programs or therapies for the client. Okay, we can give the various therapies to modify the behavior of the client. So that is the work we can say as a counselor, right? So that is the work of a clinical psychologist. So moving on to the psychiatric social worker. The psychiatric social worker is a graduate in social work and postgraduate in the psychiatric social work. He or she assesses the individual, the family, and the community support system, helps in discharge, planning, counseling, job placement, and is aware of the state laws and legal rights of the patient and protects these rights. A psychiatric social worker is the one who has got a specialized training in the field of social work in psychiatry. He or she are going to assist the client or the individual and the family in terms of the discharge, in terms of job placements for mentally ill clients, and they know very well about the laws and legal aspects, how to protect the rights of the client. So they are having a specialized interview technique, and so they are having a skill in the interview technique and also the group dynamics, as they are the one who are going to be an important person who are going to lead the community in terms of the mental health delivery system. So the next one is a psychiatric paraprofessional. So we have got, so what I had explained now is about the psychiatrist or the psychiatric nurse. Okay, we have got clinical psychologist and social worker. So these are the four important members of a mental health team. Apart from that, we have got some paraprofessionals in the psychiatry who are going to assist these, and they're going to deliver the services based on the need of the client. So we are going to learn about the psychiatric para professionals. So who are the members in this particular group? So we have got the psychiatric nursing aides or the attendants, okay, ECTs technicians, auxiliary personnel, occupational therapists, recreational therapists, diversional play therapists, creative art therapists, and the clergyman. So what are the roles and responsibilities of each of these members? So first one in that is the psychiatric nurse aide. Okay, psychiatric nursing aide or attendants. So attendants, they have a high school training and are trained on the job. So we can say they have the schooling. Yeah, they have completed their schooling and they have a specialized training on their particular job. And also they will help in maintaining the therapeutic environment for the patient and provide the care under the supervision of the psychiatric nurse. They will be delivering the care to the mentally ill clients. So next one is a ECT technician. Who is a ECT technician? So ECT is the electroconvulsive therapy. It is one of the treatment modalities in psychiatry for the mentally ill clients. So not all patients require ECT. There are some conditions wherein it is mandatory or becomes necessary for delivering the ECT. So in that time, okay, so at that time we have got the ECT technicians who are going to assist. Right. So they have a specialized training in the delivering of ECT services of about 6 to 9 months of training they have, and they have the function of keeping the ECT machine ready, and also they will be working under the supervision of a psychiatrist and the anesthetist, right? So this is about ECT technician. So next one is auxiliary personnel. They are the volunteer, housekeeper or clerical staffs, and they require in-service education to interact with the patient therapeutically. So these are nothing but the auxiliary persons are nothing but the housekeepers. Okay, so housekeepers, or we can say the clerical staffs, okay, who will be requiring the particular knowledge or education on how to interact or how to communicate with the mentally ill clients. So these are the auxiliary personnel. So next is our occupational therapist. Who is an occupational therapist? So occupational therapist undergoes a specialized training in the field of occupation therapy. He or she has got a pivotal role for using the manual and creative techniques to assess the interpersonal responses of the patient. So they are using their own creativity for assessing the responses of the client. So they are going to help the client in developing the skill in their area of choice and become economically independent. So they are going to identify what is the skill the client is having, and they're going to train those client in the particular skill so that they will be getting some kind of economical independence to work in the particular area of interest. So they help in the sheltered workshop. So this is the responsibility of the occupational therapist. So next one is a recreational therapist. Who is a recreational therapist? So he is the one who is going to plan the various activities for the client, various recreational activities for the client to stimulate the patient's muscle coordination, interpersonal relationship, as well as the socialization. Okay, so this is the one which is done by a recreational therapist. They're going to plan the various activities wherein when the client engages himself in those activities, he may require to socialize with other individuals, he may require to develop some kind of a relationship, interpersonal relationship with the other patients. And also these activities are going to give a physical strength or a muscle coordination to the client. So this is done by the recreational therapist. So based on the need of the patient, we can say need-based recreational activities will be planned by the recreational therapist. So next one is a diversional play therapist. So who is a diversional play therapist? So as the name says, you have to divert the mind of the client, right? So he is going to assist the client to divert his attention or divert his thoughts through the help of play. So especially these people are going to make observation in the children. So in case of children and in certain clients, or when they play, they're going to identify what is their behavior, which will also help them in the diagnosis, which will also help the psychiatrist to diagnose the condition. So the behavior of the clients, the behavior of the child by playing, the type of toys they choose for playing, the reaction towards the doll, beating, calling, or throwing for the focus of attention. So when a child plays, okay, in a particular playroom, okay, where there are different toys which are kept, so the child may go as select a particular toy of interest, and they may start interacting with the toy. So what kind of a behavior the child exhibits, okay, so those things will be observed by the diversional play therapist. Maybe the child may talk, the child may beat the particular toy, or they may throw the toy, or they may shout at the toy. So based on whatever the child's reaction is, the observation is made. The therapist explores the behavior of the child and relates the conditions like phobia, child abuse, separation, or any other condition. So you know very well the children are not are the ones who will not be able to express their emotions. So how will they express their emotions? Through the play. Okay, when the child is given a play, through the play they're going to express their emotion in the form of reaction. So based on the reaction or the behavior of the child when it's exhibited, we can make the diagnosis in various disorders, right? We can make the diagnosis of the condition, right? So next one is a clergyman. Who is a clergyman? So these are the religious people, okay, or the personals who may be asked to come to the hospital unit once in a week. So we can say these are the religious, members. So depending on the religious belief or the faith of the client or the religion, clergymen will be called for talking about the spirituality, for talking about the spirituality. So the clients can spend some time in the religious aspect, right? So they are going to have a religious talks with the patient. So these are the paraprofessionals who are there working in the psychiatric unit. So this is about the mental health team. So the main one is a psychiatrist, a clinical nurse, a specialist in the field of psychiatry. We have got the psychologist, and also we have the social worker. Apart from that, we have paraprofessionals who are going to work as a team for delivering these services effectively to the client. Hope you all have understood. Thank you.